Now we'll see repair. In repair, we should remember three things. Let us make it very clear and very easy to remember. In the repair, first thing you will see the inflammation phase. Second, you will see the granulation tissue formation or proliferation phase. And third thing which you will see is your remodeling wound contracture, or it is known as the maturation phase. Okay, now the first phase, which is inflammation phase, as soon as we get the cut or the injury in the body, the first thing will be bleeding will take place. Now in with the bleeding, our body's platelet will get activated and the coagulation cascade, so they will form the blood clot. So in the primary stage, as soon as we have got the cut, you will see neutrophils in the picture. So the main hero of the inflammation will be the neutrophils. After 24 hours, these neutrophils will go away and gradually there is increased number of macrophages which will be there. These macrophages, they will do all the debris phagocytic process. Then second is the granulation phase, or we can say it is the proliferation phase. As the name proliferation, so there is a proliferation of two things will be there. One is the fibroblast proliferation. So they will form the fibrosis, and second is the proliferation of the blood vessel. That process is known as the angiogenesis. And the third thing, so this blood vessel and fibroblast proliferation, that is the fibrosis, together known as the granulation tissue. But the third thing which will be there in the proliferation is the reepithelialization of the superficial layer of the body injured area. So the third phase of the repair, which is your wound contraction or maturation phase or remodeling, in that, as I told you, there is proliferation of granulation tissue will be there. So now there is a maturation of this fibrosis or the granulation tissue which will take place, and they will make the proper size wound, or the remodeling of the wound will be there. So it's very easy to remember that three phases in repair. First is your inflammation. So in the inflammation, three things you will remember. One is the blood clot, that is made up of the fibrin and platelet. Second is your inflammatory reaction, in that neutrophils will be there. After 24 hours, there is a proliferation of the macrophages will be there. So inflammation is done. Now second is granulation tissue formation, on we can say is the proliferation phase. In that, as I told you, for the granulation tissue, we need two things. One is angiogenesis, second is the fibrogenesis, and the third thing is the remodeling and the maturation. So there is maturation of the, or the collagen deposition will be there, and hence there is scarring will be there.